Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each week, we deliver informative health and wellness topics you want to know about, so be sure to subscribe to us on your favorite podcast channel. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session, streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPAcares. Now here's your host, Chief Operating Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. My name is Kyle Longton, and I'm your host. And I am back. In fact, our whole show is back after a bit of a hiatus for the last month or so. And I appreciate your patience, and we're glad to be with you again and have actually a great group of shows coming up for you in the next several weeks, covering a number of topics. And the first few are going to focus on members who are new to AFSPA, and I'll get more to that in just a minute, but I want to mention two quick things before we get into today's topic and a preview of the next few weeks. First of all, you should be receiving this episode sometime around February 27th. Last Thursday, on the 23rd, we did an AFSPA Live. That's our live broadcast that happens the last Thursday of every month. And this past was sort of an Ask Me Anything about AFSPA, and that included the Foreign Service Benefit Plan and our ancillary insurance programs. And I was fortunate enough to have our Senior Director of Ancillary Insurance Programs, Adrian Coleman Seabrooks, join me for that AFSPA Live and answer questions that came along. So if you missed that, and if you think you might be interested in it, I encourage you to go to our YouTube page at youtube.com/AFSPAcares and watch the recording of that. We had so many great submissions both before the show went live and during the live broadcast that instead of our normal half hour, we went for a full hour. So go back and check that out. See, there might be some questions that you've had that we answered during that program. And I'll just mention, look ahead for this next month for March 30th. We will be doing AFSPA Live again. And we welcome submissions and suggestions for topics that we might cover during that monthly broadcast. The other thing I want to mention is that coming up this Friday, March 3rd, AFSPA has its annual meeting. And this is something that we do, as says in the name annual, we do it every year. It's an opportunity for us at AFSPA, both our chairman of the board and the staff leadership, to give you a report of sort of what's happened in the past year and an overview of some of the things we see happening in the next year, and also to bring you some information about important programs through the voices and the expertise of our partners. And this year we have partners joining us from both Hinge Health and from Aetna, and they'll be talking about pain management, exercise therapy, our care management programs, which I'll touch on just a little bit today, and some of the other support programs we have, as well as our Medicare Advantage program. So this is a hybrid program. At this point, you can still sign up to join us virtually. I think we have over 300 people planning to join us virtually. There'll be opportunities for you to ask questions, even if you're participating from home, the office, or wherever. It is slated to begin at 11 a.m. Eastern Time on Friday, March 3rd. So go to afspa.org/events to find out more information. Now, it is the end of February, and I think that means that we have most, if not all, of the open season changes in from federal agencies. Now, I know that open season ended in the middle of December, but yes, it does still sometimes take us over 2 months to get the rest of the paperwork in from payroll offices and everything like that. Some of it literally still comes in as paper. But I'm happy to report that with the Foreign Service Benefit Plan, we saw more than 1,700 new enrollments, I should say, to the plan, even more members, because a lot of those were family enrollments, and we're glad to have all these new members. And this episode really sort of give an overview of the plan for those new members who may be looking to use their benefits for the first time, or just understand how the plan works. So we'll dive into that, and next week we'll be aiming to give an overview of our ancillary insurance programs. We've also seen an increase in dental enrollments, and I'll just mention very quickly that with our dental program, the plans are competitive with some of the FSBP plans, but the nice thing is that we offer the opportunity for members to enroll or change their enrollment throughout the year. You don't necessarily have to experience a qualifying life event. And so that's a difference in those FSBP programs. But more to come on that. Today we are focused on for the basics of Foreign Service Benefit Plan and some of the changes for 2023. So today, AFSPA Talks, welcome to FSBP. Now it's just me with you today giving an overview, but I'll try to keep it as interesting as possible. For our new members, I want to remind you that the plan does operate using a network in the United States. It is the Aetna Choice POS2 network, and it is the largest network offered by Aetna. We're approaching 2 million providers nationwide. And I mention this because if you go to an in-network provider, you will pay less out of pocket. There are negotiated savings built in through our network partners at Aetna. And oftentimes those providers should be filing the claims for you and handling that with us, and then balance billing you for your responsibility, whether it's a deductible or co-insurance, depending on the services that you receive. Now, not every provider is going to participate in every network. In fact, some providers aren't going to participate in any network. And that's okay, because the Foreign Service Benefit Plan also offers out-of-network coverage. And I should mention that the out-of-network coverage is the standard benefit of the plan. You get discounts for going to an in-network provider. So what does that mean? So if you go to an in-network provider, let's say for outpatient services, you go because you have a sore throat or an earache or something like that, not preventive services. We'll come back to that in just a minute. But for outpatient services for treatment and diagnosis, when you go in-network, you are responsible for a $300 calendar year deductible when that applies. And then the plan typically pays 90% of the services after the deductible is met, and you're responsible for 10%. If you go out of network, the deductible is $400, $800 for family, and you're responsible for 70% of the plan allowance. And I'm sorry, the plan pays 70% of the plan allowance. You are responsible for 30% of the plan allowance and any difference between the plan allowance and what the provider bills. So you will be paying more out of pocket, but you do have options to go to any provider at any time. There are going to be occasions possibly where the plan may request additional documentation to establish medical necessity. And this occurs often when you're overseas, and we'll come back to overseas. But there may be requests for additional documentation just to show that it was a service that's covered and it was a service that was medically necessary. And we will provide you information about exactly what we need when that comes. Now, when it comes to overseas care, all providers outside the United States are considered to be in-network. That means that they're reimbursed at that higher rate, the 90% for outpatient services. And again, you can go to any provider outside the US. We do not officially have a network outside the United States because we consider all providers to be a network, and because we have members in over 150 countries, and with as many different medical cultures and everything else. So managing a network in all those places would be a challenge. But we do have some direct billing arrangements, more than 175 of them in more than a dozen countries worldwide. Now, they are concentrated in countries where we have a large membership: Germany, Korea, the United Kingdom. We have some in Japan, which I covered in our last episode to an extent, and a number of other countries and those numbers are growing. We were very excited last year to establish our first agreement in Thailand. And I believe we have now 2 hospitals with more that we're working on. But that first agreement actually took us, if you can believe it, more than a decade. But the advantage of going to these direct billing providers, if you're outside the United States and have that opportunity, is that they will bill us directly. They will collect your portion of the bill, whether it's the deductible or the co-insurance. It may be nothing at the time of service, and they will send the Foreign Service Benefit Plan a bill for the rest. So you're not out of pocket hundreds or even thousands of dollars. They're sending that on to us. So that there's an advantage there. You don't have to go to those providers. It's just meant as a convenience for our members. Now, I've covered the basic coverage there when it comes to outpatient services. Let's talk about preventive care. When you go to an in-network provider, preventive care is covered at 100%. Same thing outside the United States. So preventive care is going to cover things like vaccinations, well child visits, well woman services, as well as annual physical and so forth. So keep that in mind when you're having those annual visits. Those preventive visits in network and outside the United States are covered at 100%. And also inpatient hospitalization when you are, again, admitted as an inpatient. You are actually admitted, not for observation necessarily, but actually admitted as an inpatient. The hospital charges there are covered at 100% at in-network facilities. So keep that in mind. It's just a quick reminder of the advantages of going to an in-network facility or seeing an in-network provider. Now, one of the questions we get the most, and we got some of these questions last week during AFSPA Live, is how do the alternative benefits work? And if you're new and you didn't know this, the Foreign Service Benefit Plan does offer coverage for what we term alternative benefits, and that's chiropractic services, acupuncture services, and the most popular massage therapy services. Now, oftentimes when you receive these services, whether in the United States or outside the United States, you will be paying for them at the time of service. Quick aside, for those in the US, do a network search, particularly for chiropractors and even for acupuncturists, to a lesser extent, massage therapists. You do a network search and you may actually find some providers in your area who participate in the network. But in some cases, many cases, members will book these services, they will receive these services, and they will pay the provider for the services when they receive them, and they will need to claim to the Foreign Service Benefit Plan for reimbursement. How does that work? Well, we need some information, and this is outlined in the Foreign Service Benefit Plan brochure, but I want to cover this specifically for these services because we get a lot of questions and a lot of back and forth with members trying to make sure we have the information that's necessary. So when you receive a service, and I'll just use massage because it's the most popular, when you receive that and you want to claim the Foreign Service Benefit Plan for your reimbursement, and as a reminder, you get up to 50 visits for each service per year. We reimburse up to $60 per visit. You need to submit something that shows the provider's name, the provider's address, the date of the service, something that actually lists what services were provided. So something that says massage 60 minutes, something like that. The cost of the service. This should also somewhere include your name and ID number, but you can write those in if they don't appear on it. And then one of the important things we need is the provider's either their tax ID number or their license number. Now, in the United States, many massage therapists, for instance, are individual practitioners, and they may use their social security number as their tax ID number and may not want to share that. That's okay, we understand. In that case, they can provide their license number. It just gives us a way to verify that this is a covered provider. The same is true outside the United States, where many countries do credential massage therapists or acupuncturists or chiropractors. We need that information. Now, is every provider going to provide you a neat little printout with all that information on a single page? No. And so it may be that you are pulling together different pieces of information. It may be a handwritten receipt or invoice from the provider that says massage 60 minutes, $100 on February 27, 2023. And it may be a picture of their business card and a picture of their license that they have hanging on the wall. Those three pieces together with your name and ID number, submit them to us. That will help us process that claim much faster. What we cannot process is just a cash register or a credit card receipt that just says maybe the name of the provider and an amount. That is not enough for us to process claims, and we get a lot of those every day, and it causes us to delay processing because we're coming back to the member to ask for more information. So getting that information, submitting upfront is incredibly helpful with those claims. Now we have, just to skip ahead, I want to talk a little bit about prescription drugs. The Foreign Service Benefit Plan, and here I'm talking about the Foreign Service Benefit Plan's high option plan, not the Medicare Advantage plan. I'll come back to that in just a few minutes. Foreign Service Benefit Plan has works with Express Scripts as our pharmacy benefit manager. That means they handle management of the pharmacy benefits, the prescription drug benefits that we as the plan set. Express Scripts manages a formulary, which is drugs that are covered by the plan and how they're covered, whether it's a preferred brand or non-preferred brand, et cetera. And they also actually process the claims. They have a network of retail pharmacies in the United States, and they handle home delivery. And through their partner company at Accredo, they also handle the specialty drugs. There's a lot of information about prescriptions laid out in the Foreign Service Benefit Plans brochure. Also on our website at afspa.org/FSBP, you can choose the prescription option along the side menu. But I'll just mention there that we basically operate with 6 tiers of drugs. There are the non-specialty drugs at generic tier 1, preferred brand tier 2, and non-preferred brand tier 3. And then there's the specialty drugs. Again, tier 4 is generic, tier 5 is preferred brand, and tier 6 is non-preferred brand. One of the things I will mention to you is that there are drugs that are excluded from coverage under the plan. These are drugs that have been shown to be less efficacious. They may be less safe. They may come at an incredibly higher price than similar drugs that are available on the market. And for those reasons, they are not covered by the plan. And I mentioned this is the way pretty much every plan operates in the FEHB. And so there are excluded drugs. There's different coverages. So take a look at that, understand the coverage. And please understand that if you're taking a specialty drug, if you're in the United States and taking a specialty drug, and it's something that you're taking on an ongoing basis, which is the case with many, not most specialty drugs, that you are required to obtain that drug through the Accredo home delivery pharmacy. Information is available about that in the brochure, also by calling Accredo and Express Scripts, or by calling us, and we can refer you to the right information. But please keep that in mind. That is the only way that those specialty drugs are covered. Express Scripts and Accredo also come with a huge number of support programs, including specialty pharmacists who can answer questions about those specialty drugs, what are known as therapeutic resource centers. So if you have a particular diagnosis, I've shared many times on this program that I'm living with diabetes. There's a diabetes therapeutic resource center. There's a neurological therapeutic resource center. There's an HIV therapeutic resource center, and so forth. These are call centers, not exactly call centers, but they are resource centers that are staffed by pharmacists and others with special training in conditions, who understand the condition, who understand the medications available, who understand possible interactions among those medications, and more. So I encourage you, take advantage of those programs, others that are out there, and utilize those to help you manage your prescriptions and help you manage any conditions that you may be living with. For members outside the United States, home delivery of drugs is available in some locations and for some drugs. It's not available in every location or for every drug, because some drugs do require temperature control and can't be sent everywhere because they may be sitting in a warehouse or on a tarmac for some time. The other thing is that some countries don't allow all drugs in. We may have drugs in the United States that have been approved here, but are not approved in other countries, and we can't mail them to those other countries. So keep that in mind. If you obtain a drug locally on the economy in whatever country you're living in, that's okay. That's covered too. You will probably have to pay for the drug at the time of service and then send it to us. Send us a claim with a copy of the prescription and a copy of the pharmacy receipt. That information, all of that is going to help us process that claim quickly. And we will treat it like an outpatient, like a medical claim, and consider it, I should say, at 90%. It's also helpful if you say, hey, here's the prescription, here's the pharmacy receipt. This was an antibiotic to treat an ear infection. That information helps us quite a bit as well. And that's just a general rule also whenever you're submitting a claim through our member portal or by paper, through the mail. Just giving us some of that basic information, that something more than this was a doctor's visit. We're going to ask, why'd you go to the doctor? It may be, hey, this was a checkup, or it was the ear infection, or strep throat, or I was afraid I broke my finger. Whatever it may be, give us that information. It really helps us process things faster, because it's not always on the information provided by the doctor outside the United States. Also, just want to draw your attention to Section 5H of the Foreign Service Benefit Plan brochure, and we'll link the brochure as well as some of the resources on our website. We'll put those in the show notes. But take a look at the special programs we have. We have a large number of programs to support members in pursuing their health goals, also identifying those health goals, but pursuing them, getting healthy, staying healthy, and basically living the life that you're looking for and supporting you in your wellness. So take a look at those. I just want to mention one of the big ones that we have is our care management program that we offer in conjunction with Aetna. And there's a number, I say care management program, there's actually a number of different programs that sort of fall under this heading. And they include support from nurses. They also include possible support from social workers. There's a dedicated pain management program to help those who are living with chronic pain. There's a compassionate care program that supports those people who themselves or who have a family member who are facing a serious illness or face imminent end of life decisions. There are also cancer support programs, and we have a dedicated behavioral health team within our clinical team. There are also other programs to support kidney health and healing, following joint replacement. Lots of programs there. All of that's accessible. You can get more information by calling our care management program at 800-593-2354. We'll put that information in the show notes as well. I'll come back a little bit to the Healthy Pregnancy Program because that's some changes that we've made in 2023. I mentioned that we have a dedicated behavioral health team. We also have some specific programs that are intended to support members virtually in their mental health support pursuits. Excuse me. One is the My Strength program, and if you're interested in a detailed discussion of this, go back to our very, very first episode, and you can learn more about My Strength, which is now a program offered under the Teladoc family of programs. We also offer a program with Able To. That was one of our first programs also. I think that was actually number 3. You go all the way back. And that is to support those who are facing major changes. Maybe it is a diagnosis for them or a family member. It could also be diagnosis or ongoing needs with depression, anxiety. It could also be facing the loss of a loved one or even the birth of a new baby. There's a lot of reasons someone might turn to this program. We also offer other remote programs for managing weight and diabetes and high blood pressure in a partnership with Livongo. Check out that information. Go back to our episode at the end of last year of 2022 for more information on that. And just a number of other programs that are out there to help you. If you're facing a serious diagnosis, again, maybe it's something like cancer, or maybe there's a recommendation for major back surgery or a diagnosis of a neurological condition. We have partnerships with programs for sort of expert second opinion and in some cases guidance. If you're overseas, we have a partnership with the clinic, which is a program by Cleveland Clinic, where you can email the plan, second opinion at aetna.com. That's for our plan. They'll look at it and they can connect you with the clinic program to have an expert from the Cleveland Clinic review all your information, your doctor's notes, your labs, your imaging, all of that, and give you their considered opinion based on that review of whether the diagnosis and treatment plan are on track or if you should be looking at something else. Stateside, we work right now with a company called Pinnacle Care, and our nurse care managers can refer you to that program once they talk through your considerations and your diagnosis with them. So I share all of this because a lot of these programs are available both stateside and overseas. Some of them, the clinic through Cleveland Clinic is only overseas. Pinnacle Care is targeted stateside. Able To is only available in the United States at this time. But a lot of these other programs are available worldwide. So check out the information, contact us for more information, find something that supports you. One of the things that we saw incredible engagement with in 2022 was a new program we launched last year called Lifestyle and Condition Coaching. And this is offered free of charge to members and offers coaching to support you in managing conditions or pursuing health goals in 40 different areas. So it could be that Maybe you're looking for weight management support or nutrition support. Maybe you want to sleep better, or you want to figure out finally how to exercise more, reduce your stress, or you have a specific condition like it could be chronic pain. They have individual, digital, and group coaching that is available, and at many times that should be convenient to you. Check that out. We saw thousands of people participate in this program last year and really seem to enjoy it. And many of these programs, I should say, the lifestyle condition coaching, the Livongo program, some of these nurse care management programs, Able to, and so forth, many of them may lead to incentives, which members who are enrolled in the plan, this is enrollees and their dependents who are age 18 and older, can earn up to $400 per year in incentives just by doing some of the things we should be doing: taking a health risk assessment, having an annual physical, doing a biometric screening as part of that physical, and more. You can earn up to $400, and that goes into an account and helps reimburse you for your out-of-pocket expenses, not just for dental, but you can also submit for medical. I'm sorry, not just for medical, but you can also submit for dental and vision expenses. And please check that out. You can give us a call or check out our website, afspa.org/FSBP, and you'll see a link there for our wellness program. So you can learn more there. The great clickable tool there on the website to you say, I have this condition, or I want to do this, and it'll take you to the number of programs that we offer for that. We also offer telehealth services in partnership with Teladoc stateside and with vHealth overseas. And those services are at no cost to members. So stateside, it's available for general medicine, mental health, dermatology, and nutritionist services. And outside the US, we have general medicine consultations, as well as a behavioral mental health program. So check that out. It may be useful to you rather than perhaps going to a convenient care and urgent care program, but may also lead to an ongoing relationship for counseling or therapy. Check that out. We saw a big explosion in the utilization for mental health services in 2022 for both stateside and overseas. That may be the solution for you. Now, I just want to touch on, I mentioned the Healthy Pregnancy Program before, and we've made some enhancements this year. So we want to support expectant parents in every way that we possibly can. And so one of the things we did was offer some enhancements to the Healthy Pregnancy Program this past year. There are now new opportunities to engage with our nurses who are trained in obstetrics and high-risk pregnancy. There's behavioral health support, which is a consideration that we don't always think about, both during pregnancy and following pregnancy. And there are also resources and educational materials that are available, including help with preeclampsia prevention. And there's now also a fertility advocate who is available to support members who are finding themselves unable to conceive and maybe looking at alternatives to that. And you can have a conversation with that fertility advocate about what options are available to you and what's covered by the plan. I also want to mention that there are also ways that you can earn incentives for participating in the Healthy Pregnancy Program. One, you can submit evidence of a first trimester prenatal visit. Two, you can just enroll in the Healthy Pregnancy Program. Three, have a conversation with a nurse care manager somewhere around 28 weeks to discuss your delivery plan. And four, have a conversation with a nurse care manager about 4 weeks following delivery, just to see how things are going, including the importance of behavioral health and stress management and sleep. They'll be there for all of that. You don't have to just have these conversations at those times. They're available to you throughout, but those are sort of the benchmarks, the guideposts, if you will, that we're looking for. So those are some of the changes that we made for this year. We also, in 2023, added coverage for doula services up to $1,200 per year. And so that is a new benefit. We also, as we're talking about fertility advocates, we added, and I believe we are the only national fee-for-service plan that added coverage of any kind this year. We did add coverage for assisted reproductive technology procedures, ART procedures, and that is $5,000 max per person per calendar year for the services, supplies, and drugs related to ART procedures. Now, There are conditions with that. It does have to be pre-certified wherever you are in the world, whether you're receiving the services in the United States or outside the United States. It does have to be pre-certified. So please, please, please check out the information in the brochure. Go back. We did an episode about this back last fall. It was a truly informative one with one of the senior medical directors who manages this program and provides coverage about why people face infertility, and some of the challenges that come with that, and then also some of the solutions that are out there for addressing it. We also did some episodes last summer, both about mental health around infertility diagnoses, and also some episodes with families and how they grew their families, either through adoption or through procedures such as IVF. So check those out. We are glad to offer this support for our members. But again, please, whenever you may be facing this or considering options for ART procedures, call us to make sure there's a fertility advocate. There's also a dedicated pre-cert line for the ART procedures. Call and get the information upfront so you know sort of going to institutes of excellence that is required in the United States, and also understanding what's required for the benefits to be available. Also in 2023, we did add a expanded coverage for nutritional formulas for the treatment of inborn errors of metabolism. This is something that your family is facing. You know exactly what this is. And so please, please, please be in touch with us if you have questions about this. And I want to touch just briefly, we did add a Medicare Advantage program, officially the Foreign Service Benefit Plan at the Medicare Advantage program. This was something that we offered because we saw demand for it. So a lot of other plans offering this in the FEHB program. We let them go first, figure some things out. We got some advice from our colleague plans about how best to do this. And we actually saw more than 500 individuals opt into the program during open season. And it is an opt-in program. You can return to the Foreign Service Benefit Plan, high option plan at any time throughout the year if you decide that the Medicare Advantage is not for you. But some of the reasons people decided to opt into this plan are because it offers some additional support. With original Medicare and Foreign Service Benefit Plan, you have access to our care managers, but they're not going to know when you have, let's say, a hip replacement coming up or another procedure, because there is no pre-certification process through Medicare, or for us, because we're secondary payers and we have original Medicare. And so we're not able to reach out to you proactively and provide that support. With the Medicare Advantage plan, there is pre-cert, but it's mainly so that to make sure procedures are medically necessary, but also so that those care managers can be in touch with you to plan during the hospital stay, plan for your discharge home, your rehab, things like that, and they will be with you every step of the way. And that is sort of a proactive program with Medicare Advantage. It also offers additional programs like meal delivery following inpatient hospitalization. It offers non-emergency transportation to medical appointments. There's also the program that we've been hearing requests for the decade that I've been at AFSPA, and that is Silver Sneakers. And this is a wellness and sort of fitness program that is offered to people enrolled, and it can offer you access to local gyms. It also offers a number of classes that are available online for health and wellness. And that has been one of the biggest things that we've seen a demand for over the years. So that is of interest to you. Check it out. A couple of things to keep in mind. First, this has been something that's come up in some conversations I've had recently. When you enroll in the Medicare Advantage plan, you're also enrolling in a Part D Medicare prescription plan. And that is part of it. It's a whole comprehensive plan. The prescription drug benefits are different. In many cases, your out-of-pocket costs will be less, but those prescription benefits are managed by CVS Caremark. They are no longer managed by Express Scripts once you enroll in the Medicare Advantage program. Because you're enrolled in a Part D plan, I should also mention that if you hit the means testing under Medicare, which means you may be paying more for your Part B coverage, B as in boy, then you may also hit means testing for Part D coverage, and you may also see an additional premium for the Part D deducted from your monthly Social Security or assessed when you have to pay your Medicare premiums. It is lesser amount. I think it starts, the first level is less than $13, but some people were surprised to see this. So I want to encourage you to keep that in mind. One of the big reasons people were drawn to this program, though, is also that we offer a $75 per month reduction for your Part B premiums. That is one of the big reasons people sign up for this. It's a great plan, but it also offers you reduction in cost for your Part B premiums, and you'll see that taken immediately. If those are being deducted from Social Security payments, with Aetna's communicating with Social Security, that money's already deducted, so you'll actually see more money coming into your bank account from Social Security. Otherwise, you'll see, if you get the payment booklets or something like that, or direct debit from your bank account, you'll see less coming out. So keep that in mind. That's one of the big advantages of the Medicare Advantage plan. Again, though, make sure it's right for you. You must be enrolled in Medicare Part A and Part B. You must be a resident of the United States to enroll in the Medicare Advantage plan. I'm going to pause there because there's so much more that I could say, but I promise just an overview. We have more information coming about our ancillary programs next week. And I want to say thank you for spending this time with me. Thank you for listening to this overview and some of the changes we made in 2023. We're always looking for information and your impressions. So please leave us information, feedback on our Facebook page, on LinkedIn, and even on Instagram. And let us know what you think. Let us know if you have ideas for future topics or things that you want to hear about just in the general benefits, health, wellness sphere. We're always looking for that feedback. We want to make this program as useful to you as possible. In the meantime, I will talk to you very soon once again, and I thank you again for subscribing and for listening. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. The views and the opinions shared on this podcast by the host and guests are theirs alone and do not necessarily represent AFSPA or any of its partners. All information offered in this podcast is meant to be educational. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or the other products offered by AFSPA, the policy provisions will prevail. Thanks for listening, and be sure to subscribe to AFSPA Talks to catch your next episode on your favorite podcast app. Please rate and review us on your favorite app and share feedback with us on Facebook, Instagram, and LinkedIn. I'll talk to you again soon.
Thanks for joining us this week on AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live on our YouTube channel at youtube.com/AFSPAcares at 11 a.m. Eastern Time to answer your questions. Thanks for listening.